I welcome you all for Dr.Nimisha's Ph.D. Viva Voce. Sir, I welcome Dr. Thaimoogambigai sir, the senior most person. He was also there when I was teaching. Interesting topic. She is talking about the nexus between periodontal disease and the respiratory disease. She has taken two different topics. Like she is talking about, I think we are all aware about the pandemic, what we went through. And she is discussing about the pandemic and periodontal disease and the most common respiratory disease, COPD, and the link between that and periodontal disease. And to talk about Nimisha, she is my PG student as well. And she's showing the same sincerity like how she was there before. The same sincere effort she had put in for the last 4 years, and I'm very, very proud to have her as my student, and she's one of the role model students, we can say. And the forum is to you, Nimisha.
So good morning all. Today I'm here to present my research on exploring the nexus between periodontitis and respiratory disease, a comparative evaluation of galectin-3 level in coronavirus disease 2019 patient and role of NETOSIS and microbial dysbiosis in chronic obstructive pulmonary disease patients with and without periodontitis. So these are the contents of my research work which I will be detailing further. So oral and systemic health are deeply interconnected, each shaping the other's balance. So the mouth often mirrors early signs of systemic disturbances. Recognizing this link strengthens diagnosis, prevention and comprehensive patient care. So is periodontal disease a risk factor for systemic condition? So what is chronic periodontitis? It's an infectious inflammatory disease which is caused by the bacteria of the plaque, resulting in the progressive destruction of the tissue. So recently there has been a resurgence of interest between the periodontal disease and respiratory disease. Why? Because there is an anatomical continuity between oral cavity and lungs, making oral cavity a reservoir for the colonization of respiratory pathogens. So coming to global disease burden, India accounts for around 32% of global burden of respiratory disease, out of which chronic obstructive pulmonary disease has got 384 million cases per year, and around 3 million people die every year, and it is considered as the third leading cause of death. Then second one, to examine and compare the salivary and serum galectin-3 level in periodontitis without the history of COVID-19 patients and in a post-COVID and periodontitis patient. So the third objective is to assess the prevalence of the respiratory pathogen Pseudomonas aeruginosa in the subgingival plaque of COPD with and without periodontitis patient. Fourth one, to investigate the presence of periopathogen, that is red complex bacteria and Fusobacterium nucleatum, again in the lung fluid that is called as bronchoalveolar lavage fluid, again in patients with COPD and with and without periodontitis. Fifth objective is to assess the salivary level of NETOSIS biomarker scintillated histone 3, again in COPD with and without periodontitis patient. And my sixth objective was to compare the effect of non-surgical periodontal therapy on pulmonary function, salivary scintillated histone 3 levels and respiratory pathogen burden in patients with periodontitis and those with both COPD and periodontitis. So my research included two prevalence study. First one is actually association between COVID-19 and periodontitis, which included 2 case control study. And second one is association between COPD and periodontal disease, which included 3 case control study. and one interventional study where included non-surgical periodontal therapy in reducing the pathogen load and NETOSIS biomarker level in periodontitis and COPD with periodontitis patient. So sample size was calculated, then ethical clearance was obtained from the institutional ethical board, and then informed consent was obtained from all the patients. And moving on to my first module, that is association between COVID-19 and periodontitis, which had two case control study. First one analyzed salivary and serum galectin-3 level in COVID positive individuals with and without periodontitis, and second one to which compared salivary and serum galectin-3 level post COVID periodontitis patient. So totally 120 patients were enrolled, out of which 4 were absent for the study and 2 declined to participate. So healthy controls, group 1 had 25 healthy control, group 2 25 periodontitis patient, group 3 23 COVID-19 patient, group 4 22 COVID-19 plus periodontitis patient, and group 5 post COVID-19 plus periodontitis patient. So all the patient respiratory patients, I mean COVID patients, were obtained from Lalithambika Medical College and Hospital during the period from Jan 22 to December 2023. So once they turned RT-PCR negative, after taking their willingness to take part in the study, they were scheduled for periodontal examination. So group 1 included healthy patients where there was no visual signs of gingival inflammation, no clinical attachment loss, and their serological test for anti-SARS-CoV-2 was negative. And group 2 also included periodontitis patient, and they also had serological test was negative. Group 3 included RT positive, PCR positive patient, but periodontally healthy. Group 4 included RT positive patient and with periodontitis. Post-COVID included moderate to severe COVID-19 cases who had moderate to severe COVID-19 cases, that is their oxygen saturation was less than 94 and they were hospitalized. Such patients were included in post-COVID group and they also had periodontitis. Thank you. Thank you one and all.
It's a very good presentation, Nimisha. It's a very good scientific research topic selected. A very good data interpretation and also clinical relevance is very good, actually, interdisciplinary study. Those are very good informative. Just I would like to some points to clarify from you.
Presentation.
Okay, very good presentation. As you defended everything, there's some queries and questions raised by whoever is present here. So I would highly recommend you to an award of Ph.D. from Dr. M.G.R. University.
I thank you all for joining. In the beginning, I went into the topic, so I just want to share a few words about Nimisha. She is one of the my best student, and I can say she is also a family friend of mine. You know, but even though she never takes advantage, she knows she can get the things done. But she's to the core. She did everything by herself, and she went and collected all the samples, and it went as she had planned. And I would really suggest, my PG students are here, I just want them to take her as an example. You know, she puts in her maximum effort and she gets the best of it, and one of the best good human being. And thank you all for joining us, Nadeem, Hari and Vijay from Addl, all our family people who are supporting her throughout. And special thanks to Rajesh. I think last 4 years, he has really contributed so much. And thank you, Ramalingam sir, for joining. So, நீங்க உட்கார்ந்து கேட்டதே எங்களுக்கு பெரிய விஷயம் சார். Thank you so much. உங்களோட blessings நால தான் எல்லாமே நடக்கும் சார். Thank you.